Morung Express, 2nd of December 2023, following China, several nations report an epidemic of Chinese virus pneumonia. COVID-19 caused suffering to the entire world, and it is currently returning from China to infect the planet once more. Days after China, Denmark and the Netherlands are the most recent nations to announce a pediatric pneumonia outbreak. Mycoplasma pneumoniae infections have reached epidemic proportions, according to a post on the infectious illness news blog Avian Flu Diary. The increase in these infections started in the summer and has accelerated during the last 5 weeks. The number is now so high that it is an epidemic, the Statens Serum Institute in Denmark said. Senior researcher Hanne-Dorthe Emborg of the Statens Serum Institute was reported as saying, "In the past 5 weeks, the number of new cases has increased significantly, and we are currently seeing significantly more cases than usual, and that there is widespread infection throughout the country." Mycoplasma pneumonia infections were found in 541 new cases in week 47, more than twice the cases in week 42, 168. A substantially more significant number of instances likely exist if all patients with mild symptoms are checked. As for Denmark, which has historically had national epidemics of Mycoplasma pneumonia infections roughly every 4 years, Emborg noted that the instances are not unusual. Autumn and early winter are usually the highest seasons, according to her. The current pandemic is not unusual, given that there have been remarkably few Mycoplasma infections over the previous 4 years. We have been waiting for it since we shut down the nation during the COVID-19 pandemic, according to Emborg. The illness frequently manifests as moderate flu-like symptoms, including headache, sore throat, exhaustion, and a persistent dry cough, particularly at night. Most people have a fever, though it's usually not as high as it is with influenza and other more traditional forms of pneumonia. It has been dubbed cold pneumonia or atypical pneumonia because, according to the Post, conventional penicillin does not affect the infection. According to a government monitoring report published on Flu Trackers, an infectious disease news message board, last week, the Netherlands reported the most significant increase in pediatric and adolescent pneumonia cases since August. The Netherlands Institute for Health Services Research, NIVEL, reported last week that among children aged 5 to 14, pneumonia affected 103 out of every 100,000. According to NIVEL data, this was a 24% increase over the 83 recorded in the previous 7 days. According to reports, this is the biggest pneumonia outbreak NIVEL has seen recently. In 2022, 58 children were hospitalized with pneumonia weekly during the busiest flu season. During that time, cases in children under 4 increased from 124 to 145 per 100,000. According to local media in the Netherlands, the National Institute for Public Health and the Environment and NIVEL have not been able to explain the rising number of pneumonia cases in the Netherlands. In the meantime, a recent study published in The Lancet documents a rise in Mycoplasma pneumonia cases following COVID-19 in several nations, including Singapore and Sweden, since April. The increasing number of pneumonia cases in these nations coincides with allegations of a Mycoplasma pneumonia outbreak in China's pediatric hospitals and clinics. China denied the existence of the novel pathogen suspected to be causing the upsurge in respiratory diseases. Chinese authorities notified the World Health Organization that Mycoplasma pneumoniae and well-known seasonal viruses like the flu and RSV were the actual cause of the infections, with no new pathogens in the outbreak.